Representative Jasmine Crockett, Democrat of Texas, appeared on Chris Hayes' show, All In. And interestingly, Chris Hayes, she went on to discuss the big, beautiful bill, right? The one big, beautiful bill that really is a big, ugly bill, a bill that really harms most Americans. After going through quite a bit, Chris Hayes pointed out something interesting. And he asked her, where is the hospital lobby? To which Crockett didn't quite have an answer. But she made the point that we don't know where the hospital lobby is, but the reality is this big bad bill, also known as the big beautiful bill by Trump himself, would actually cause a lot of hospitals, mostly in red states, mostly in rural areas, to close. Listen to this and then we'll take it on the other side, because while she didn't have the answer, I can give you the answer empirically. Let's listen to this and we'll take it on the other side.
When I used to cover Congress day in, day out, was that the hospitals were big interest groups.
They are.
They will drop money on your head if they don't like it. They will be up in your office.
Yes.
Where are the hospitals? Honestly, it's wild to me that they have not shown up in a big way.
I don't know.
To fight this bill.
I have no idea. I mean, it's kind of like you saw the farmers, right? Like when we were going through that, like continuing resolution, the farmers were like, wait a minute. Like they showed up, like the Farm Bureau was like, we are here, right? And so it is odd because the hospital lobby is a really big lobby. And a lot of people probably think of lobbies and they think, oh, you're going to be the antithesis of me. But when you're talking about rural America, like I lived in East Texas, let me tell you, hospitals are shutting down. And in rural America, you don't have as many providers either. And so literally, if you have this specialized cancer, you can't stay at home. You've got to go somewhere else because there's no one that knows about the help that you need. So it is really odd. And I tell you this, that there's going to be more hurt that comes to red states than blue states. Blue states can actually take in a lot of this, not to say that they should and not to say that it's right, but like it will be
disproportionately red states will get hurt by the Medicaid cuts in both these versions of the bills.
Yes, absolutely.
Chris Hayes is right to ask. During the Obamacare debate, the hospital lobby was deep in it. In fact, a lot of the bad pieces of that bill really came to pass because the hospital lobby didn't want certain things done, etc., because they figured it would affect their bottom line. But somehow they are not very concerned about the big, bad, beautiful bill. Why is it? And, as I rack my mind, you have to realize what's the purpose of this bill. The purpose of this bill is to take away, to find ways to give the wealthy, the corporations, the big folks, a huge tax cut. And the way to do that is to take away a lot of the benefits from middle class, working class, and poor Americans. So again, the question is, hospitals. There are a lot of hospitals that are going to be closed in rural areas. There are a lot of hospitals that are going to be closed in red states. Why aren't you out there fighting to say, no, Mr. President, this is going to hurt us? You have to realize it. These hospitals in rural areas, they don't care about those small town doctors. They don't care about those small town nurses. In fact, the way they feel, if those hospitals close, there'll be a lot of room for these people to work in the cities. There'll be a lot of places for these people to work in the centers where the profit really is. You see, when you have these rural hospitals, they run on a shoestring budget with small profit margins, if any. So it's really there as a service because you want to have a body there to go ahead and bring, for all the poor people that are living there. But again, if a large percentage of these people are giving you Medicaid money and the big hospitals can get Medicaid money and other money, they would look and say, well, you know what? we get a big tax cut, and that big tax cut is way more in the aggregate than what profit these rural hospitals will make anyway. So why fight the bill? Let's make the big city hospitals and the satellites in the big cities more profitable, and to hell with the rural hospitals. So we constantly screw the folks in rural areas, and by implication, we screw the red states. But the only way you get to screw the red states if you fool the red states, because they are the ones who support the people who are going to screw them. Because their leaders had never, ever cared about them. That is why in Texas, where, and I repeat this ad nauseum, in Texas, where for the first 3 years of the Affordable Care Act, people could get Medicaid, the state paid zero, and all these people would get insured. But the state of Texas said no. Likewise, after 3 years, they could get the Medicaid for 10%. In other words, the government would pay 90% of the bill, and Texas would be responsible for just 10%, small amount. And to the Texas citizens, Texas said, the Republican Texas legislature say, no, I'd rather you die than to have to pay 10% more in your health care. And this goes on and on and on with policy and policy and policy. They cut SNAP. They cut support for food banks. And what happens? Who does that hurt? Our brothers and sisters in West Virginia, who are very, very, very dependent on food banks in a lot of these areas in Appalachia. But they don't care. They have, even before the big bad bill, even during the time that Obamacare was coming into effect, even the times when the Inflation Reduction Act was coming into play, they never cared about you. The Democrats made sure to put these factories, the green factories and green policies in red states, hoping that red state politicians would say, wait a minute, if these green energy programs are in our states, then we can't really get rid of it because it'll hurt our people. But what does the big bad bill do? The big bad bill in the House version just about drops it to zero almost immediately. The Senate is trying to do a little bit of negotiation, but again, it harms their own people in order to give the money to the wealthy. It is essential that you see this, folks, as they have you hoodwinked on social issues like abortion and 10 Commandments and go deport the immigrants and all these things. As they work on all of that to distract you, they're there taking your money. They're there taking your wealth. They're there taking your livelihood. They never, ever cared about you. They never even made an attempt to care about you. But somehow, you still vote for them. You've got the evidence, folks, and it's going to come to pass. If this bill goes through, the rural areas are going to feel the extensive pain first. And those doctors that are going to leave those closed hospitals, they'll have jobs. They'll be driving back to the city. And the city folks, the folks that they tell you to fear, they'll have good health care because they'll have even more doctors coming in from the rural areas after those hospitals close. They'll have more nurses from the rural areas after those hospitals close. There's one industry that you'll have some people there, but it's going to make you poorer. The ambulance services will stay in the rural areas because they'll have to transport you 100 miles to the hospital. And then when you get your loved one in accidents, when you get your loved ones with heart attacks, if they don't die before getting to the hospitals, if these ambulances, many of them private, gets you to the hospital, you're likely going to have to sign your home away to pay the bill to get to the hospital 100 miles away. So you see, they're screwing you up front, and you'll be screwed again if you get hurt and have to be rushed to the hospital. And God forbid you have to use the helicopter, because at that point, you probably also lose your form. Folks, look, I can't express this in more detail. Jasmine Crockett nailed it. Yes, it's going to affect the rural hospitals. Chris Hayes nailed it. Where the hell is the hospital lobby? And what I'm telling you is they've done their cost analysis, and they figured, to hell with the rural hospitals. To hell with them. You guys are the ones who need the Medicaid more than anyone else. And since the Medicaid doesn't pay as much as we can in the city, to hell with it. The tax cut will more than make up any tiny profit, if any, we would have made in those rural hospitals. And then the real estate from that rural hospital, that still has some value. So that stays on the books as value for the person or the entity who once held that hospital. All I can say is, my rural brothers and sisters, my red state brothers and sisters, you better get with the program, because your own is coming for you.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number 1, subscribe to our channel. And number 2, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.